Okay, let's be honest. Seeing someone have a seizure can be really scary. It's one of those moments where you can feel completely helpless. But what if you knew exactly what to do? That's what we're here for. We're going to turn that fear into knowledge and give you the confidence to help someone safely and effectively.
So just imagine for a second, you're on the train, maybe grabbing a coffee, or just at your desk at work, and the person right next to you suddenly collapses and starts shaking. What do? That split second of panic and uncertainty is exactly what we're going to replace with a clear, simple plan.
Here's our roadmap. We're going to break this all down into 5 easy parts. First, we'll cover what a seizure actually is and the different types you might encounter. Then we'll get into the real core of it all, how you can help, how to know when it's a true emergency, and we'll touch on a couple of special cases you should know about.
All right, so Section 1, what even is a seizure? Before we can talk about helping, we got to understand what's actually going on inside the brain. And the best way to think about it is like a brief but intense electrical storm.
Now, the official clinical definition is pretty straightforward, right? A seizure is just a period of abnormal electrical activity in the brain. But what does that really mean in plain English?
Well, this analogy really helps. Picture your brain's normal activity as this perfectly organized power grid. Signals are zipping along pathways, everything's orderly. A seizure is like a lightning strike hits that grid. It's a sudden, chaotic, disorganized burst of electricity that short-circuits everything for a little while. And that internal storm is what causes all the physical signs that we see on the outside. But here's the thing. Not all storms are created equal. Depending on where in the brain that storm hits, the signals it sends out to the body can look totally different. So let's learn how to decode those signals. Okay, so the 2 main categories you'll hear about are generalized and focal seizures, and this chart lays out the difference perfectly. A generalized seizure is when that electrical storm hits the entire brain all at once. This is the one most people picture. The body gets stiff, then there's that rhythmic jerking, and the person loses consciousness. But a focal seizure, that starts in just one specific spot. And because of that, the signs can be, well, all over the place. It might just affect one arm or cause a weird taste or smell. The person might even be totally aware that something strange is happening to them.
And that brings us to the real reason we're all here. What can you do to help? This is so important. Your role isn't to be a hero and stop the seizure. Your job is simply to keep the person safe while that storm passes.
Just remember these 4 simple steps. Step 1, and it's the most important, keep them safe from injury. Step 2, and this is absolutely critical, time to seizure. Pull out your phone and note the time it starts. Step 3, after it's over, help them with their airway. And finally, Step 4, just stay with them. Be a calm, reassuring presence as they wake up.
So let's get specific on that keep them safe part. You absolutely do want to protect their head. You can slide a jacket underneath or just cradle it gently. Do move sharp things away, like the corner of a coffee table. But just as important is what you do not do. Do not try to hold them down or restrain them. And please, please hear me on this. Never put anything in their mouth. That is a dangerous old myth. You can break their teeth, injure their jaw, or you could get bitten.
Now, the good news is that most seizures stop on their own after a minute or 2, but sometimes they cross the line and become a real medical emergency. So, how do you know when you've hit that tipping point? How do you know when it's time to call 911?
If you remember one thing from this whole explainer, let it be this number: 5 minutes. A seizure that goes on for longer than 5 minutes is a serious medical emergency. It's a condition called status epilepticus, and it needs immediate medical help. That 5-minute mark is the absolute red line. It's why timing the seizure right from the start is so vital.
So besides that 5-minute rule, there are other clear red flags. You should always call for help if someone has one seizure right after another without waking up in between, or if you have any reason to think this is their first ever seizure. Definitely call if they seem to be having trouble breathing afterward. And some situations are always an emergency, if the person is pregnant, if it's an infant, or if the seizure happened right after a head injury.
So after the seizure ends, the person is going to be really out of it. They might be confused, exhausted, disoriented. That's totally normal. This is the recovery period. And as our source material says, most people are pretty much back to normal within about 20 minutes. But if they're still really confused after that 20-minute mark, that's another sign that they need to get checked out by a professional.
All right, let's wrap this up by quickly touching on a couple of special cases, because sometimes the context of who is having the seizure and why is everything. You may have heard of these, febrile seizures. They happen to little kids, usually between 6 months and 5 years old, when they have a high fever. For a parent, it is one of the most terrifying things you can see. But they're usually not dangerous, and they stop very quickly. But that 5-minute rule, it still applies. Any seizure in a child that lasts longer than 5 minutes is an emergency.
And here's another incredibly serious one, an eclamptic seizure. Any new seizure that happens when someone is pregnant or even in the weeks after they've given birth is considered a major obstetric emergency. This is a critical situation that needs immediate, expert medical attention for the safety of both mother and baby.
So, when you boil it all down, it comes back to this one idea. Knowledge turns anxiety into action. Just understanding what's happening, what a seizure is and what it isn't, completely transforms you. You go from being a panicked bystander to a prepared, effective helper. And your calm, informed response can make all the difference.
Think about it. In just the last few minutes, you've learned steps that could literally save a life. So the next time you see this happen, you won't be the person who freezes. You'll be the person who knows what to do. You'll be ready to be the difference.